King Khaled Eye Specialist Hospital was conceived out of concern for the hardship that the Saudi people endured in traveling abroad to seek treatment and surgery for their ocular problems. The late King Khaled recognized the need for his country to have a comprehensive treatment and research center devoted only to eye care. In the late 1970s, King Khaled and his ministers proposed the creation of an eye center that would serve the entire Middle Eastern region. The government donated 2.5 kilometers of land in northwest Riyadh for the project. King Khaled closely followed the progression of its construction. By June 1981, the hospital, a mosque, 22 villas, 6 5-story apartment buildings, a community center, and tennis courts were completed. The remainder of the hospital, roads, landscaping, and additional housing was completed in late 1982. The hospital began operation in December 1982. The King Khaled Eye Specialist Hospital is now the largest and most widely respected facility of its kind in the Middle East. King Khaled Eye Specialist Hospital is a modern healthcare facility which provides tertiary care to the citizens of Saudi Arabia and neighboring Gulf countries. The hospital employs more than 1,200 individuals, including 70 full-time, board-certified physicians, 50 ophthalmologists, 10 anesthesiologists, 6 internists, 2 pediatricians, 1 radiologist, and 1 pathologist, more than 200 nurses, and 200 technical and administrative support staff. The hospital has 228 inpatient beds, a major operating room with 12 dedicated ophthalmic theaters, an outpatient clinic with more than 50 examination lanes, and a large emergency room that is in continuous operation. In 2008, there were approximately 100,000 visits to the outpatient clinics and more than 26,000 visits to the emergency room. There were approximately 10,000 inpatient admissions and more than 10,000 surgical procedures performed in the major operating theater. The Department of Ophthalmology offers tertiary ophthalmic services through its subspecialty divisions, which include anterior segment, glaucoma, vitreoretina, pediatric ophthalmology and strabismus, oculoplastics and orbit, neuro-ophthalmology, and uveitis. These divisions are staffed by board-certified ophthalmologists who have graduated from accredited residency training programs and have completed a minimum of 1 year subspecialty fellowship training. The departments of medicine, anesthesia, and pathology facilitate ophthalmic care by providing essential non-ophthalmic services. These departments are staffed by board-certified graduates of accredited residency and fellowship programs in their fields of specialization. The glaucoma division provides evaluation as well as medical and surgical treatment of glaucoma and diseases characterized by increased intraocular pressure. In addition to adult patients, the division provides care to many children with congenital and juvenile glaucoma. A nurse-led glaucoma assessment clinic provides routine follow-up screening of intraocular pressure and medication refills for patients between their regularly scheduled visits with the glaucoma consultant. The neuro-ophthalmology division provides evaluation of a wide variety of disorders which overlap the fields of ophthalmology, neurology, and general medicine. These include neurological visual disturbances, anterior and retrobulbar optic neuropathies, double vision, oculomotor nerve paresis, ocular motility, and alignment disorders. The vitreoretinal division provides care to patients suffering from diseases of the posterior segment of the eye, namely the retina, choroid, and vitreous body. This division also collaborates with the pediatric ophthalmology and strabismus division in the management of retinoblastoma, as well as with the uveitis division in the management of complicated cases of posterior uveitis. Diagnostic imaging examinations, diagnostic assessment information, photographic documentation, and drug therapy are supported by the Diagnostic Imaging Department, the laboratory, the Ophthalmic Photography Department, and the pharmacy. Outpatient care is provided in the outpatient services, the screening clinic, the emergency room, and the short stay unit. The primary mission of outpatient services is to provide tertiary care in an outpatient setting with dedication to excellence in the provision of patient care. Inpatient services include the major operating theaters, the post-anesthesia recovery room, the central sterilization and supply department, and the inpatient units. The eye bank provides donor tissues for Saudi and non-Saudi patients who are candidates for corneal transplant, epikeratoplasty, scleral graft, and amniotic membrane transplantation at the hospital and other eye care facilities in the Kingdom of Saudi Arabia. The Health Education Department helps promote awareness of ocular and general health issues, thereby helping patients engage in behavior that maximizes their potential for positive health outcomes. Efforts are made to increase community and public awareness of preventative and safety measures related to eye and ocular disorders. The Medical Education Department provides in-house and regional programs for residency and subspecialty fellowship training, as well as continuing medical education in ophthalmology. The department participates in the 4-year Riyadh Residency Training Program in ophthalmology. It is administered under the aegis of the Saudi Council for Health Specialties and follows the American model of residency training. The Subspecialty Fellowship Program provides advanced training in each of the major areas of ophthalmology, including anterior segment, glaucoma, medical retina, neuro-ophthalmology, oculoplastics, ocular pathology, pediatric ophthalmology and strabismus, vitreoretinal diseases and surgery, and uveitis. The hospital offers an attractive benefit package comprising tax-free salary, annual salary increase, 45 days of paid vacation per year, 12-month initial contract which is renewable, free furnished and fully equipped housing, free utilities including local phone calls, free and extensive recreational facilities in a safe environment, free health care, mobilization and repatriation airline tickets, annual airline ticket to your point of hire, service awards, and unique travel opportunities. For more than 2 decades, the King Khalid Eye Specialist Hospital has been recognized for excellence in its delivery of ophthalmic patient care, for its strong educational programs, and for its highly successful research programs. These achievements have been made possible by the grace of Allah, the Almighty, and through the generous ongoing support of the government of the custodian of the 2 holy mosques, King Abdullah bin Abdulaziz Al Saud.